Hi, my name is Shellee, and I'm from Billings, Montana. And I was blessed with having the gastric sleeve surgery done by Dr. Alvarez January 22nd, 2013. And it has been one of the best days of my life. It has changed my life forever. And I never dreamed that my life could be so normal and so fulfilled. I've lost 232 pounds year to date, and I'm so pleased with the results. And it, some people may view gastric sleeve surgery as cheating to lose weight. It's not. It is a tool, but it certainly helped me get to that point of losing a lot of weight that I needed to lose that I thought was absolutely impossible. And I'm so grateful for that. Before the gastric sleeve surgery, I was a single mom for 16 years, and about the last 8 to 10 of those years, I really lost myself being a mom and trying to do everything, and just lost sight of who I was. I couldn't have even told you what flavor ice cream was my favorite. I ate myself. That was my friend, and almost ate myself to death. And I realized as time was going on and my third child and baby was getting ready to leave home, I realized that I was just living to die. I didn't have thoughts of suicide, but I really was just existing. And I'm 52 years old and thought, wow, my life's just about over. And I'm thinking, what are you thinking? And realized that I needed to get some help. And even though I had tried, I think, every diet that there is possible out there, and some of them multiple times, and I'd had some success, and I would always gain the weight back and then some. And I'm sure I've lost over the years well over 1,000 pounds, and then packed all that on, and had gotten up to 400 pounds, and decided that this was it. I'm done. And I knew that I needed to deal with what was going on the inside. And I had been journaling. I had just really trying to find out what was going on with me. I dealt with that first, and then realized I needed somehow to have a tool that would help me get healthy again. And that's when a friend of mine, I had been talking to a dear friend who was trying to encourage me to do gastric bypass surgery or the lap band surgery, and I did a lot of research and investigating that and looked into seeing if my insurance would cover it, and they wouldn't. And so I didn't have any predisposing health issues like diabetes or high blood pressure, even though I was borderline on both. They wouldn't cover it. I decided one day that I was going to do this. A friend of mine had had gastric sleeve surgery in Mexico. I thought she was absolutely crazy. I'm like, oh my gosh, you're going to take your kidney. Why would you do that? And she came back. I watched her just like evolve into this new person. Her life had changed so much, and I wanted that. And so I started investigating doctors in Mexico and realized, wow, this is something I could actually afford without selling my house and living on the street. And Dr. Alvarez was very affordable, and his price is way above beyond fair. And for what you get the best surgeon on the continent that does sleeve surgeries, and he's perfected his craft and his skill. Just attended a reunion. He talked about how in the beginning it took him an hour and a half, and now he's doing surgeries in 25 minutes. And my surgery 2 years ago was 35 minutes. And my sister was scared to death. She said, "You're not going to Mexico by yourself." And she had to go with me, and on her choice, I was going to go alone. And she realized that there really wasn't anything to be fearful of. She was blown away at the professionalism, the cleanliness, the way we were treated. It was amazing. And that's the one thing that I would have to say, that for the first time in many years, I was treated with dignity. I never felt prejudged by anyone that I dealt with Dr. Alvarez's staff, and especially not with Dr. Alvarez. I was treated with the utmost respect and dignity, and they saw me as a person, not as a fat woman that was too big to fit into a seat, or that I was disgusting. I felt loved and cared for. And I remember Dr. Alvarez looking across the desk and looking into my eyes, and he said, "Shellee, this will change your life forever, and hit the nail on the head, because it certainly has changed my life forever. Beforehand, I would walk down the hall at work. I was short-winded. I had friends and coworkers that told me that they were fearful that I was going to keel over and die any day. I hated to go anywhere because I remember one time in a Walmart parking lot, I was walking into Walmart and some young kids drove by and they told the fat cow to move out of the way because they were driving their car through the parking lot. And I remember feeling hurt, but then immediately put that shield up and went in and bought a bunch of food to take home and patch up that hurt, and sat and ate that, and really just fed more and more into my depression about my weight and just the cycle that I had gotten myself into. You know, if you follow exactly what Dr. Alvarez tells you to do, it's such a no-brainer. He makes it easy, but it's, you know, it takes your part to take on that responsibility. This is your sleeve. This is your life. And he does his job, and he does it very well. You know, you have a part in this too, and I just need to take that seriously. So my life beforehand was basically going to work Monday through Friday, work long hours. I would go home, I would sit in my recliner, and I would eat. My one kid that was still at home was working nights, so I never saw him. And I'd go to church on Sunday and go back to my house and just, you know, wanted to eat and watch TV and just be a hermit. After losing the 232 pounds, I work out 5 to 6 days a week. Sometimes I replace one of those workouts or a couple of those workouts and go on hikes. I live in Montana, and it's a beautiful state, and there's lots of things to do outdoors. I went zip lining this last summer. I've been alpine sliding. Went camping, learned to fly fish, did snow angels up in the mountains in the middle of the summer. We hiked so high we went to the snow. I'm starting to date after almost 17 years of not being with anyone, and it's fun. I feel like I matter in life to myself. Look forward to every day. It has so many opportunities in it to just live and feel alive. And I'm so proud to be able to pass that on to my kids, that I'm no longer a victim in life, but I have purpose and meaning to my life, and that I'm not giving anyone else responsibility for my life but me. And my kids have really appreciated the change in their mom. And the only thing I regret is I wish I would have done this a lot sooner. But this is a gift that Dr. Alvarez gave to me and the good Lord gave to me, and I don't plan on blowing it. A couple of things that tipped me over the edge to go to Mexico. I'm in healthcare. I'm a physical therapist, and I actually specialize in wound care. The thought of going to a foreign country to have medical care was pretty scary until I started watching several, and I mean every night I probably would watch 20 different YouTube videos of people that had gone to Mexico to have Dr. Alvarez do their surgery. And on YouTube it was one particular OBGYN from New York, and he talked about how, you know, I know Americans probably think, oh, you're going to a dirty place or a dirty hospital. But he goes, I can attest to the fact that this is a very clean and sterile environment, and you get good care. And for a physician in New York to say that, I felt like there was, maybe I should be a little more open-minded to this. The final thing that tipped me over the edge was actually watching the video and learning a lot from Dr. Alvarez's YouTube videos about him talking about the sleeve, but then actually watching an actual surgery and how he walks you through each step of the surgery and what he does. And when he talked about suturing up the staple line, so that would help ensure, again, no leakage, and looking into seeing how he had less than a 1% infection rate, and he didn't have there were 0 deaths. And, you know, there were a lot of things about Dr. Alvarez's track record that just really impressed me. But that YouTube video of his surgery, I thought, wow, this guy really does know what he's doing, and he is perfecting this. And he seemed to really care about his patients. And listening to everybody talk about Dr. Alvarez, I just thought, boy, he just sounds too good to be true. It's like this guy walks on water. Well, he's pretty darn close. He doesn't actually walk on water, but he cares so much about his patients. He doesn't forget you, and he knows that he is there to make a difference in your life and to change your life. He does just that. The staff there at the hospital, the nurses are very, very professional. They use good techniques. You're very comfortable. They check on you frequently. Dr. Alvarez and the other surgeon, the interpreter, she's right beside you, but they're in your room, except when you're resting, they're in your room checking on you all the time. And I never felt like I was in a foreign place and fearful ever. I was picked up at a very nice hotel with my surgery buddy and my sister, and we were taken across the border. They told us exactly what to expect. Dr. Alvarez even has a YouTube video with the van ride. It is exactly what the video shows. There were no surprises at all. And if you really are serious about it, you have all the tools at your fingertips online. And I think Dr. Alvarez and his staff have done a beautiful job of preparing people for what to expect. Actually, when I came back, I shared with people that I know in healthcare that I work with and said, I think that Dr. Alvarez really has one up on America, because I think that he does such a professional job in the way he treats his patients and the way he's made it so affordable for people to do this. I think America could really take a lot of lessons. I did not have any complications. I was on a pre-op diet because my BMI was over 50%. It was at 51%. Dr. Alvarez really wanted me to lose 30 pounds before I went down there. And I didn't. I lost 24 pounds, but I followed his pre-op protocol very well. I went down there, had the surgery. You know, when he talks about, getting up to walk around, you have your air, they blow up your stomach a little bit to pump it up with air, and it's really important to get up and move around. And within 4 hours, I was walking around in the hospital with my IV pole. I was very comfortable. I did not have any pain whatsoever. The only time I felt anything was where they removed the stomach from. I could feel, if I moved wrong, I could feel a little stretch with the stitches. But he gives you a pillow that you carry with you on the airplane ride back, or any kind of movement getting in and out of the van to go to the hotel and go back. That was the only thing. As I introduced myself to solid food, I remember that first day, and that was I think 2 or 3 weeks later, and he has it all planned out for you. But, again, you just got to follow what he tells you. And I remember eating a little too fast. I had some fish and sweet potato, and I ate it too fast, and so I threw it up. But I learned quickly just to slow down and take just really, really small bites. Don't drink with your meal, and again, just following the rules. And as far as complications go, absolutely none. I took a few extra days off when I came back just because I thought I would need it, but I really didn't. I would say the first 24 hours, it felt good just because of traveling. It felt good to rest, but everything just seemed very normal for me. I think that, when you're still on the liquid diet, you can expect to feel a little weak but you're not immobile, like you have to lay around. I worked 8 to 10 hours a day, Monday through Friday, and I was fully capable of doing that and carrying on about my normal activity. And again, just following what Dr. Alvarez stresses to you about what to do and what not to do. I have friends that have also had sleeve surgery done by American doctors and even some other Mexico doctors, I should say, and they have had complications. They don't know always what to expect, and I think that Dr. Alvarez does an amazing job of education. And I really think that, the more we are educating ourselves, we're empowering ourselves to succeed with the sleeve. I know Dr. Alvarez has helped many patients out that have been operated on by other surgeons even. I feel so blessed. I also called Dr. Alvarez because of losing such a large amount of weight. I had some excess skin around my abdomen and on my upper thighs and my arms, and called and spoke with them, Susan, and she talked to Dr. Alvarez, and they gave me a surgeon's name, Dr. Monroe Wilson, that is also in Mexico. He's in Monterrey, Mexico. Dr. Alvarez has gone to school with him, and I was, I shouldn't have been amazed, but I was amazed just to hear Dr. Wilson. He called me, talked to me directly 4 different times. One of our phone calls lasted 45 minutes. He answered all my questions, but he had the work ethic of Dr. Alvarez. He would not keep me on the operating table, to get everything done in one fell swoop, because he said my health and my safety come first. And he said there are physicians out there that will do that for you, but he said I won't. And he said, again, I take my job very seriously. You're entrusting your life with me. And I thought, bingo, here is another Dr. Alvarez. Thank God. He removed 12 pounds of excess skin from my abdomen, and it was 1.5 feet from top to bottom. Wow, I've never had a flatter stomach. It feels great. It excites me. I'm going back in January to have the excess skin removed from my arms and my legs, because I love to swim, and I'm looking forward to putting a swimming suit on and feeling confident with that, to match the hard work that I've done with my sleeve as well. And I feel very blessed to have done that part of my journey as well. Again, it goes back to the beginning with Dr. Alvarez.